Hi, I'm Dr. Tariq Karim. I'm American Board Internal Medicine Consultant, currently working in Amina Hospital, Ajman. Today, we're going to discuss about most common disease called migraine. And the important thing about the migraine is to understand where does migraine come from. It all starts with the fifth cranial nerve, which is also called the trigeminal nerve. It supplies the face, the back of the face, and the forehead. This is where all the migraine happens. So let's start with first of all, how does it show up? Most of the people have migraine which involves the half of the head, frontal, the temporal, and the occipital regions. It's not necessary. Some people have got headache in both parts of the head, on top of the head also. And the typical presentation of migraine is divided into two types. Is the migraine which has got some things happening before the migraine starts, called migraine with aura. In these patients, you have got some visual disturbances. You see jagged lights in front of the eyes, some smell problems. This happens usually 30 minutes, more or less so, before the real headache starts. Headache comes. But there is another type which is called migraine without aura. In this type of headache, nothing like jagged lights or smell or taste disturbances occur. The headache just comes suddenly and then it keeps increasing until it reaches the full migraine headache. Now, this is the jagged lights that the people with aura see. Why some people have got migraine with aura and some people have got migraine without aura? It all lies in the genes. You see, some people have got disturbances in the genes in the station of the migraine, and some people have this migraine with the abnormalities in the nervous part of the migraine and the vascular part of the migraine, as you can see in this picture. And it can be a combination of different genes. So one part is predominant and one is without aura, and then sometimes some portions of the aura show up and some patients of the aura shows up. It all depends on the combination of different genes that are transmitted familially in the patients with migraine. There are certain migraine triggers like lack of sleep, stress, anxiety, physical stress, too much caffeine or caffeine withdrawal. You skip meals or some meals which are rich in tyramines. Have got different type of meals which they get triggered, their migraine gets triggered. Now, migraine itself, the typical migraine with aura has got four phases. The first phase is prodrome, in which even before the beginning of the headache at that day, the patient is feeling agitated, he's constipated, he's irritated, he's yawning too much, he's having some feeling of nausea. There are certain types of food cravings. The patient is having increased urination, the stiffness of the muscles. And then after a variable period of this prodrome, these patients develop a typical aura, which is bright flashing lights, sparkles of lights, blind spots in the vision, which are called scotomas, tingling sensations on the skin, some dysarthria, some speech problems, ringing in the ears, vision loss in the temporal regions, and sometimes a funny feeling, a change in smell. All these are the parts of the aura. As I said, it is all dependent upon which nervous genes are transmitted in the person. Then starts the headache, in which the severe headache starts with the sensitivity to light and noises. There's nausea, there's vomiting, there's sweating or chills or change of color, speech changes, dizziness and tenderness over the scalp. And some people rarely they can get diarrhea and fever also. After a variable period which can last from 4 hours to 72 hours, in which the patient confines himself to a dark room where he cannot hear voices and he's curled up in the bed, goes away and the post-drome phase starts. In this patient, he's feeling depressed, fatigued, Sometimes he's feeling euphoric, he's not understanding things properly, he's unable to concentrate. And in children with special type of migraines, they don't even have got the post-migraine paralysis, which is called thoughts palsy. In this case, the patients may be having paralysis or quadriplegia lasting for some time after the attack of the migraine. So these four phases of migraine, as I said, because of the genetic transmission, can be complete or incomplete, typical or atypical, but some of these features you'll find in the patient with migraine. As I said, now it is a little bit in a pictorial view, animated features of prodrome, attack phase, aura stage, and post-drome stage, as you can see. The same things I explained, it is shown in the pictorial phase. Now, I have seen migraine. It's not a migraine alone. Sometimes there is a migraine complex. I mean, the migraine itself is associated with some other conditions also. The most commonly which I see is the patients who have got migraine attacks. They have got GI disorders. They have got irritable bowel syndrome. Some patients with migraine have got associated with gluten sensitivity and celiac disease. And then there is another group of patients who have got this migraine, which is associated with psychiatric disorders. The patients are having migraine attacks, but they're also suffering from anxiety, depression, panic attacks, bipolar attacks. Then there is another group of patients who have got sleep disturbances related to these migraine attacks. These patients can have sleep disorders, insomnia, snoring, sleep apneas, and on top of that, they get frequent migraine headaches. The other group that I have seen is it's usually in children. The children with the migraine, they have got neurological disorders also. It's a special group of diseases in neurology in which the migraine is associated with the strokes or epilepsy or essential tremors or Tourette syndrome. This is very common in clinical practice, but there is a special chapterology specialty dealing with these type of syndromes. The other thing which is seen in the patients with migraine is association with mitral valve prolapse, sometimes hypertension. Raynaud's phenomena is also described in the patients who have got a migraine. So these are the migraine comorbidities. That means migraine does not come alone. It comes with other disorders also. Another pictorial view which gives you a pretty good summary of most common disorders associated with this migraine, these comorbidities. As I said, mood disorders, gastrointestinal diseases, mitral valve prolapse and hypertension, insomnia, and one more thing, fibromyalgia. Yes, fibromyalgia is seen in the patients with the migraine. I have seen quite some patients who have got migraine, but they've got fibromyalgia also. Now, when a patient comes to us in our clinical practice, we have to differentiate this migraine from the other conditions. Some things are very peculiar to migraine, and that gives us a clue. First thing is there's a familial history of migraine. The patient's mother is having, some brother or sister is having, and she's also having. So family history is important. Second thing is it starts from early age. From childhood, these starts. They've got a long history of the migraine as compared to the other disorders which do not have that long history. There are people who have got some digestive problems, flatulence, gases, and they also present with headache. The GI symptom predominant, but again, as I said, migraine itself can be associated with GI symptom. The other thing which very commonly confuses, in the sinus headache, in the sinusitis, it's more in the front of the face, in the maxillary regions, in the frontal regions. It's more in the morning when the patient is getting up from the sleep and he's having these sinuses have to drain and they put a pressure, and it's more in the morning. The tension headaches is usually in the temporal regions. It is usually bilateral and in the mandibular region. There's tenderness over the muscles. Patient has been clenching his teeth, and which is giving him these tension headaches. Again, history is important. Familial history is also important in the patient, and sometimes it's a diagnosis of exclusion. Blood pressure can cause pain, and high blood pressure can occur without headache also, usually on the back of the head. And then there are certain cluster headaches which comes in the form of a thunderbolt, and they are very severe headaches. One part of the eye associated with eye symptoms, and they are pretty easy to differentiate from the headache pain. due to the nature of the pain and its periodicity. The other thing is we have to differentiate the patients with the pain. Other thing is we have to differentiate the patients with the pain as compared to the pain which has got very sinister reason, like a pain of a brain tumor or the pain of a arachnoid hemorrhage. These type of pains, usually pain of subarachnoid hemorrhage, is sudden in onset, and it's kind of a pain that patient has never observed before. Patient can recognize his migraine headache because there are always some familiarity with the type of headache. But when this is a subarachnoid hemorrhage, it comes with the vomiting, severe vomiting headache you have never experienced before, loss of consciousness, pupillary changes, so differentiated. The other headache is the headache of the brain tumors. This tumor headache is like different from the headaches before in the life. Early in the morning, it is much more associated with vomiting. It can wake up the patient from the sleep. So these are some red flags for the headache that you should worry about. Talk about this the pathology of this headache. So I'll go to the board and I will explain it to you, schematic drawing, how this migraine happens.